You have seen some of the most cruel aspects of this system, firsthand. So what were your thoughts when people were reacting and responding to his murder?
I was pleased that there was such an outpouring of political and political economic analyses. So, that's what we used to call propaganda by the deed, and haven't seen too much of that in this country in a long time.
Well, Jeff, what did you think? Why do you think politicians took they didn't really want to engage in the discussion about healthcare. They wanted to kind of shame people for this outpouring of anger. Why were they so reluctant to speak to the people about it and not and engage with people rather than kind of say scold people for responding, to this?
Right. The mainstream media has been its usual heedless self, and there's been very little analysis of what any of this means, particularly in Baltimore, the mainstream media here, the Sun and the Banner, and
right.
There's just, and the governor who just announced that, of course, he isn't in favor of violence. Well, yeah, we kind of knew that, although that remains to be seen.
Mm-hmm.
But that's true throughout American society, that nobody's in favor of violence, and the people in power aren't in favor of doing anything about it.
Mm. In the sense of doing anything about the healthcare system. You had another question.
Oh, well, Professor Singer, I was hoping that you could help us by maybe unpacking some of the myths regarding Medicare for all. I mean, there are a lot of falsehoods out there. The idea that Medicare for all or universal health care would be, let's say, even a form of socialism. What are some of the falsehoods people believe, and what is the truth?
Yes. Well, if only it were a form of socialism, but it isn't necessarily. That's one of the ways that the ruling class tricks people into not working for what they want and for what they need by using the derogatory form of socialism that, of course, all good Americans are supposed to be opposed to. And they've been very successful with that for 150 years.
Yeah. I mean, it's interesting because we were talking before the show with our esteemed editor-in-chief, Max Alvarez, and a couple other people who have had access to nationalized healthcare. He was in England. He said it was amazing.
Yes.
Why have our politicians been successful in scaring people about a nationalized health system? It seems like it makes total common sense, but on the other hand, we have this sort of running through that we all like our private insurance or whatever. Why have they been so easily able to tarnish the idea of a national healthcare system?
I don't precisely know the answer to that, but as I mentioned, there's been almost 150 years of negativity around the term socialism. And although nationalized health insurance isn't really a socialist solution, on the other hand, England has had socialized medicine since World War II.
Right.
It's very, very popular, and it's very, very effective. The Commonwealth Foundation released a report a few months ago called Mirror, Mirror, and it evaluates the healthcare situation in 10 countries, 10 advanced industrial countries. And one that spends the most and has the worst outcomes is, of course, the United States.
Right.
Number 3 in their analysis is the United Kingdom, which is socialized medicine.
Yeah. I mean, technically speaking, Medicare is socialized medicine, right? I mean, technically speaking, by definition, right? Medicare?
Well, Medicare, though, pays private providers.
Well, there's a Medicare Advantage, but then there is a Medicare system that doesn't, right? Or I guess you're right. They're private providers. So that's I see what you're saying. That's very distinct. Yeah. They don't have private providers in England or other countries. You're right. Good.
Very few in the United Kingdom. Now, other countries like Germany and France, they do have private providers, but they're treated pretty differently than they are here.
Jeff, I wanted to ask you something just so that you could speak from your personal experience. I mean, you have really dealt with a system that denies healthcare for poor people or for people who can't afford housing, and you actually did something about it by helping build healthcare for the homeless. What did you see and experience, trying to get people who are left out of our system and denied by it?
Well, it's interesting, Taya, that most of the people with whom we worked, and that was 100,000 different people that we worked with for 25 years at Healthcare for the Homeless. And that was, 15 years ago, so there's more now. But they were and are people who have not had access to health services, which exacerbates all their health problems. So they can't take advantage of the wonderful possibility of advanced health services that the United States does have, but it benefits a small number of people.
Yeah, I mean, how in the process you were working, we talked about the administrative costs in our private health insurance. How much was that administrative state a problem in terms of delivering healthcare because it's so expensive and sort of usury? How much was that a problem for you to deal with?
Well, we were required, financially speaking, to become integrated into the existing health system. Mm-hmm. And that is complicated and expensive. There's lots of reporting that has to happen. Mm-hmm. And, computer systems. We had spent a lot of money buying computer systems. People spend a lot of time using the systems that exist. And a lot of that is unnecessary. Not all of it, but a lot of it is.
Yeah.
There's a huge amount of money that is wasted on those systems.
I wanted to ask just about some of the lessons that you've learned from doing healthcare at such a grassroots level that maybe we could learn from to help us push for a more comprehensive healthcare plan. I mean, is there a way to change this system? And perhaps you could share with us some of your ideas to do so.
Well, aside from having a socialist revolution.
No, you can talk about that.
Until we do that, I don't think we'll have an equitable and effective healthcare system. But there are non-socialist countries that have much better healthcare systems or a lot more equity, for sure, and higher life expectancy and lower morbidity. So all of the data shows that when everybody has access to decent health care, everybody benefits, not just their health, but their pocketbooks. Right? It's so much cheaper to make sure that everybody gets good preventive care. And maybe that'll happen with our new health secretary.
Yeah. Well, I mean, I want to ask you, if you're organizing around this idea, what is the biggest roadblock to, there's a million of them. Okay. The political system we have now, who's in power, but is it entrenched special interests like the AMA or something? What makes it impossible to even have this conversation, or is it propaganda? Just curious what you think.
Yeah, well, the AMA has been involved in assuring that there isn't equitable healthcare for many, many years since there was an AMA. Every time a national figure would advocate for healthcare for all, not necessarily Medicare for all, that's one example, but the AMA would spend as much money as they could, and that's a lot of money, to make sure that the discussion isn't a real one, that people are tarred and feathered. When they talk about socialized medicine or when they talk about healthcare for all, and it's unfortunate that so much time and money is spent on making sure that we don't have a system.
Right.
Well, so
that's amazing.
We spend, twice as much as any other country, and yet our health outcomes are the worst among advanced industrial countries.
Jeff, I wanted to ask you a question because I had been looking, I was on Open Secrets and they do great work. If you ever want to find out, what your local politician is receiving in their campaign coffers, go take a look, you'll see. And I was looking and I saw that there was a lot of donations from the healthcare industry. And in particular, I was looking at the United Health Group and Vice President Harris received a large sum of money, actually even larger than the sum of money President-elect Trump received. But there was plenty of money sloshing about, both with Democrats and Republicans. And I was wondering, on your thoughts of how many layers do we have to unpack here? If our politicians are, let's say, being influenced by this money, can you give us some suggestions on how we can start taking this power back?
I wish I could effectively do that because the health industry is one of the largest and most profitable in the U.S. And they spend more money on lobbying than anyone else, except, maybe the oil industry. I don't know. I haven't seen the figures recently. But because so much money is spent on maintaining this system that does not work well for most people in this country, but that's backed up by the propaganda, as you said, Stephen. That so they reinforce each other. Yeah, the industry. There's billions, hundreds of billions of dollars are made by these profiteers, and until that gets addressed, nothing changes. Right? Well. Who supports that? Some nice people do, but not the captains of industry, because that's how they have their three houses and Jaguars and right. So they're going to do whatever they can to assure that real changes don't happen. Like Obamacare, that's not a real change. That didn't in any way interfere with the privatization and financialization of health.
Well, Professor, let me just ask you one last question before we bring on our guest, Kat and Prem. I'm starting to think here, I'm getting the impression from you that perhaps, Professor, we might just need a revolution. Is it time for us to just start getting in the streets and protesting and ringing our Congress people? Is it time for us, to have folks
a revolution on YouTube?
Well, to, really take action and pushing our politicians to do what we want, which is reform the system.
Yeah, well, my old friend Gil Scott-Heron, famously said that the revolution will not be televised, but it might be on YouTube.
Yeah, it could be. Well,
this could be a time when some changes will happen, and that's what's exciting about the reaction to this event.